Welcome to episode 362, where I'm talking about the imbalances and disorders which can occur in the nervous system channel, or Majja Vaha Srotas, such as MS, multiple sclerosis, Alzheimer's, Parkinson's disease, and neuralgia. I also discuss the possible causes of these disorders and steps that we can take today to prevent these conditions. So please stay tuned. Hi there, I'm your host Colette, and on this podcast I will be sharing the teachings of Ayurveda, yoga, and holistic health practices. Now, if you're new to Ayurveda, I recommend checking out the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. Thanks for listening, and now here's a new episode. What if you could know what the stars have aligned for you and use that knowledge to navigate life events? Join Kerala Ayurveda Academy for an engaging online workshop in Vedic astrology from November 9th to 11th. This ancient practice is highly relevant today, providing profound insights into your strengths and guiding you in health, relationships, and personal growth. Learn to interpret your birth chart and use this knowledge for self-awareness or as a valuable tool in your holistic profession. Enrich your wellness journey and sign up today. To learn more, visit keralaayurveda.us/courses/Vedic-astrology. And for $50 off, use the code 50VEDIC, and I'll put all that info in the show notes. Hello and welcome back to the Elements of Ayurveda podcast. It's Colette today for a solo episode where I'm discussing all about the imbalances and disorders which can manifest in Majja Vaha Srotas, or the nervous system channel. So let's get straight into it. Majja Dhatu is our nervous tissue, and it's located in the bone marrow. This nervous tissue is formed after Asthi Dhatu, which is our bone tissue, in the sequence of tissue or Dhatu formation. So in the nutrition of the Dhatus, the nervous tissue is formed and nourished after Asthi Dhatu. And therefore, the root or mula of this channel, Majja Vaha Srotas, are the bones and the joints. Majja Vaha Srotas is the channel carrying nutrition for the bone marrow and nerve tissue. The opening of Majja Vaha Srotas is the synaptic cleft, which is the space between two neurons across which impulses are transmitted. The passage or marga is the nervous system, including the central, peripheral, sympathetic, and parasympathetic nervous system, the brain, and the cavities of the bone, like the spinal column and the auditory cavity. The most important function of Majja Vaha Srotas is communication, including both motor and sensory responses for our five senses. The limbic system is part of the brain involved in our behavioral and emotional responses. And these responses occur through Majja Vaha Srotas, along with communication, coordination, sensation, learning, and memory. Majja Vaha Srotas is responsible for filling spaces in the bone, in that the bone marrow. Now, if you want to know more about the functioning of Majja Vaha Srotas and the subdoshas involved, then check out episode 290, where I went into detail on that. Because in this episode, I'm going to delve deeper into the imbalances and disorders which can manifest in the nerve channel. So let's start by looking at some of the signs and symptoms of aggravation of Majja Vaha Srotas, the nerve channel. There could be cracking, pain, stiffness, or swelling in the joints, neurological symptoms, tingling, numbness, tremors, tics, and spasms, ringing in the ears, feeling of darkness in front of the eyes, dizziness, lack of stability and equilibrium, vertigo, anxiety, fear, lack of sleep, insomnia, sensitivity to noise, memory loss, short or long term, burning or coldness of hands and feet, Bell's palsy, which is a temporary facial paralysis, convulsions and seizures, neuralgia, which is pain along the nerve tract, and peripheral neuropathy, which refers to any condition that affects the nerves outside your brain or spinal cord. Now, if these early signs and symptoms of imbalance in Majja Vaha Srotas are not pacified, then they can manifest into further disorders. And disorders of Majja Vaha Srotas can involve the nervous system and bone marrow, which can result in various neurological, hematological, meaning related to the blood, and mental health issues. So here are a list of just some of the disorders which can manifest in the nerve channel. The first one we have is MS, or multiple sclerosis, which is a chronic progressive condition where the immune system attacks the protective covering of the nerve fibers, the myelin sheath, which then disrupts communication between the brain and the rest of the body. This condition is primarily a Vata disorder with involvement of ama, or toxins, obstructing the Majja Vaha Srotas. The next condition is Parkinson's disease, which is a progressive neurological disorder that affects movement. Symptoms include tremors, stiffness, and difficulty with balance and coordination. Parkinson's is often related to a Vata imbalance affecting Majja Dhatu, the nerve tissue. Degeneration of the nervous tissue occurs due to an increase in Vata and depletion of nourishment in the brain and the nervous system. Alzheimer's disease is a progressive neurodegenerative disorder that primarily affects memory, thinking, and behavior. Alzheimer's can be a result of a Vata aggravation and ama accumulation, leading to depletion of Ojas, which is our vital energy reserve, and Majja Dhatu, the nerve tissue. The next condition is aplastic anemia, and this condition occurs when your body stops producing enough new blood cells. This condition leaves you feeling fatigued and more prone to infections and uncontrolled bleeding. Osteomyelitis is a bone infection which can occur when a bacterial or fungal infection spreads to the bone and can cause painful inflammation and swelling in the bone marrow. And the final condition is paralysis, which is one of the most common disabilities resulting from a stroke, where the muscles or groups of muscles lose their ability to move. This occurs because the brain, which controls muscle movement, can no longer send the necessary signals via the nervous system or Majja Vaha Srotas. I'm going to discuss now some of the possible causes of aggravation of Majja Vaha Srotas. First of all, poor nutrition and a diet lacking in essential fats and nutrients to support the nervous tissue and bone marrow. Vata aggravating foods, especially if you have a high Vata constitution. We see that in many of these conditions, there is a correlation with an imbalanced or aggravated Vata. Incompatible foods. According to Ayurveda, there's certain food combos that should not happen, and I discussed this in detail in episode 26. Chronic stress and a busy life where you're always on the go, overstimulation of the nervous system, emotional stress and unresolved emotions, anxiety and emotional exhaustion. It could be due to accident, trauma, or shock to the body. Long-term sleep issues and insomnia, stimulants like alcohol and drugs, exposure to heavy metals, bacterial or viral infection, fever, and an accumulation of toxins or ama in Majja Vaha Srotas. So let's look at the Ayurvedic approach to managing Majja Vaha Srotas disorders. And as we know in Ayurveda, there's no one size fits all. So there really needs to be an individual diagnosis, an individual and tailored treatment plan. But when examining the health of Majja Vaha Srotas, the nervous system, the senses, sight, touch, smell, and hearing, perception of pain, coordination, memory, and the emotional state of the rogi should be taken into consideration. Disorders of Majja Vaha Srotas often involve the nervous system and bone marrow, and their treatment requires a holistic approach. Ayurvedic management focuses on balancing the doshas, and particularly in this case, the Vata dosha, providing nourishment to the Majja Vaha Srotas and the Majja Dhatu, which is the nerve tissue, through Rasayana or rejuvenation therapies, Ayurvedic herbs, and lifestyle adjustments, some of which could include nutrient-dense foods to nourish Majja Dhatu, like ghee, avocado, nuts, and oils, lots of good fats to nourish that nerve tissue, incorporating periods of rest and relaxation to calm the nervous system, mindfulness practices like yoga, meditation, pranayama, time in nature, Rasayana oil treatments or rejuvenation treatments like Abhyanga, the warm oil massage, or Shirodhara, where it's oil flowing on the forehead, which deeply relaxes the nervous system. Nasya, which is a nasal oil treatment, which helps to nourish the brain and nervous tissues. All of these Ayurvedic therapies can help to calm the nervous system and nourish the nerve tissue. Ayurvedic herbs to strengthen the nervous system and enhance cognitive function, very helpful. And of course, an Ayurvedic Panchakarma, which is an in-house healing regime incorporating Ayurvedic foods, therapies, medicine, etc., all under the supervision of an Ayurvedic doctor. And this is one of the best course of treatments for established disorders of Majja Vaha Srotas. Now we can see that there are a lot of diet and lifestyle interventions here. And that shows that by having these simple practices in our daily routine, as Ayurveda suggests, we can help to maintain the health of Majja Vaha Srotas and prevent these imbalances from arising. So here's some general advice to help prevent imbalances in Majja Vaha Srotas. Incorporating dinacharya, or the daily self-care practices to help you live in tune with the circadian rhythms and keep the doshas in balance, in particular the Vata dosha. Managing stress. This is unfortunately a necessity in our world today, and incorporating time for mindfulness and time to switch off and find out what really works best for you. Making sure that you have nourishing relationships in your life, personal, professional, and healthy social interactions to support your mental health. Now, if all this is very overwhelming to you and you're not sure where to start with implementing Ayurveda and these practices into your life, well, I can certainly help support you. First of all, I have lots of free info, 7 years of free info in my podcast episodes. But if you don't want to go through all that faff and you want information that's really tailored to you and your lifestyle, then you might be interested in my online consultation, where I put together a strategy for your diet, your lifestyle, your self-care, exercise, mindfulness, and so on, to really help you maintain balance and prevent illness. I educate you on your unique constitution, your subtle signs of imbalance, so that you can feel empowered to really take charge of your own health. And of course, I address any current imbalances. I also have my Digestive Reset Cleanse, which is an individually tailored holistic cleanse program to help you reset your physical and mental health. This cleanse comes with a 90-minute online consultation with me so that I can tailor the recipes, the self-care, the mindfulness, and so on to you and your lifestyle, and I support you throughout. And finally, if you want to study by yourself, I have my online Daily Habits for Holistic Health program. This is a 28-day self-paced program with the objective to help you become your own healer. I teach you about living in tune with the circadian rhythm and how to implement these daily self-care practices. I educate you on the principles of Ayurvedic healing and also how to connect with your intuition so you can really feel empowered in making your own choices. And then you can combine all these services, the consultations, the cleanse, and the Daily Habits for Holistic Health program in my full Reset, Restore, Renew program. I know this is a lot of information, and I have comparison chart on my website where you can check out in detail exactly what's involved in each program. And I'll put that link in the show notes. Or if you have questions before you book, please take advantage of my free 15-minute online Services Enquiry Call. We can hop on Zoom and I can answer all of your questions. So that's it for this episode. I hope you found this episode on the imbalances in the Majja Vaha Srotas helpful. If you find that you're getting benefit from this podcast, I would really appreciate a rating and review wherever you listen to your podcast. And thank you in advance for that. And if you haven't subscribed or followed the podcast, please do so. And the new episodes will automatically download for you every week. Please come join me on social media. You can find me on Instagram. My new page is Elements of Ayurveda Podcast. And on Facebook, it's under Elements Healing and Wellbeing. Thank you so much for tuning in. And until next time, take good care of yourself, be well, and bye for now. Slán go fóill.